I'm Kaylee, this is Shannon, and this is Bailey. We are from the Russell FFA chapter. Giving an injection is an important part of any animal health regimen. Often, for many medicines and vaccines, injection is the best way to administer a drug to an animal. And the overall purpose of an injection is to benefit an animal. However, if not done properly, there is potential to harm the animal. A poor injection may not be absorbed correctly and therefore may not be effective. Additionally, a result of a poor injection may cause scar tissue, abscesses, or leave behind drug residue, which causes the animal further pain or suffering.
Before using any product or administering any drug to an animal, in our case a steer, one of the most important considerations is to read and follow the label carefully. The label of any drug should contain the product name, the active ingredient, and the concentration of the drug. Product usage directions, instructions for preparation if needed, the formulation of the product describing the contents of the package, warning statements describing hazards to humans' health and safety associated with handling the product and any restrictions on use. The withdrawal time, the recommended time between the last treatment and the slaughter of the animal for food, precaution statements that will alert you to storage and safe handling requirements to maintain product stability and potency, and indication statements describing the species, class of livestock, and disease conditions for which the product is to be used. Dosage and administration statements describing the directions for use, the route of administration, and the intervals between treatments. Cautions and contradiction statements warning about hazards to animal health and safety. Restricted uses, which are limitations for use of the product.
Once the label has been carefully read and understood, it is important to know how to give whatever type of injection is being required by the label. Next, the animal to be given the injection would need to be identified and placed into a working facility. Restraint of the animal is the next most important step in the process. Restraint, such as a squeeze chute, is used to prevent injury, not only to the animal, but also to the person giving the vaccine, and to prevent the needle from getting broken off in the animal due to sudden movements. As the animal is being ready to go into the chute or the working facility, it is important to have the drug and needles ready. Hands should be washed before and after handling medicines. Vaccine bottles will need to be cleaned with an alcohol swab directly before loading the syringe. A new sterile needle will need to be used for each injection. A bottle of injectable medicine should never be re-entered with a used needle. When finished with the bottle, all needles should be removed. All products should be stored away according to the label.
Next, it is important to use clean equipment. Whenever possible, disposable syringes should be used. If using a reusable syringe, they should be cleaned according to the type of medicine they are being used for. When choosing a needle, it is important to use a sterile needle for each animal. Single-use disposable needles should be used whenever possible. Reusing needles can spread infection from one animal to another. It is possible that the same needle may be used for multiple injections, giving many doses in a short time, such as in a feedlot. If this is done, the needle should be changed frequently, about every 10 animals. Next, choose the smallest needle size that is reasonable for the use of the product, and volume that is needed to be injected. This should be done to minimize tissue damage and reduce the leak of the product from the injection site. Needle's length is another important factor. Shorter needles, such as a ½ inch to an inch, would be chosen for a sub-Q injection. Longer needles, up to 1.5 inches, would be needed for an intramuscular injection. Size of the animal should also be taken into consideration, as animals which have smaller muscle mass should be injected with the proper length of the needle to prevent injury and other issues.
Next, we'll move on to the proper technique for performing each type of injection. With intramuscular injections, the first consideration is to inject into a muscle that is of lesser value to the consumer. In cattle, intramuscular injections are given into the neck. Fill the syringe to the level which is indicated on the label. Remove the air bubbles by tapping the syringe, causing the bubbles to move towards the tip. Then use the plunger to push the air out of the syringe. Intramuscular injection should be given deep into the muscle, using a needle long enough to penetrate the skin, subcutaneous tissue, and fat to reach the muscle. The needle needs to enter perpendicular or at a 90-degree angle to the relative surface of the animal. giving subcutaneous injections, they should be given halfway up the neck, in front of the shoulder, or over the ribs, well behind the shoulder. A 1/2 to 1 inch needle should be used. To give sub-Q injections for cattle, lift a fold of skin to make a tent. Insert the needle through the skin at a 30 to 45 degree angle relative to the surface. Finally, for IV injections, it is important to get advice from your veterinarian due to the specialized technique for administering an IV drug.
We've covered some precautions and proper ways to administer a vaccine to a steer. When poor technique is used, problems can arise. These problems are as follows. The treatment may fail if the product is not absorbed correctly, on time, or is blocked. Drug residues left behind in the meat may not be absorbed and metabolized in a timely manner. The animal may suffer or be incapacitated due to nerve damage and swelling from tissue reactions. In extreme cases, the animal may go into shock or die due to medication unintentionally entering the bloodstream. A human could accidentally be injected, which could result in a fatality depending on the type of medicine being used.
Last, it is very important that we keep well-documented records of vaccinations kept. A written record of a treatment administered to individuals or groups of animals should be kept. Record the animal's identification, date or dates given, treatment was given, the product name, the amount given, the route of administration, and withdrawal period. Any time that medicines are being dispensed, the veterinarian should also have legible written instructions, especially if they recommend using the product in a manner different than the label directions. This has been Kaylee, Shannon, and Bailey of the Russell FFA chapter showing you, demonstrating how to give a shear a shot.